Elle Kotopoulos. Great conversation with Elle. Fascinating background. She graduated from Columbia, went into finance and banking. She was there for 9/11 in Manhattan. Then she went into fashion. She created her own line. Her father was an OBGYN, and she could remember as a child him having to wear bulletproof vests because he had an abortion clinic, and they're in New Jersey. And soon after, the person that took over, there was an opportunity. Her brother's a lawyer. She took over the clinic. So now she has this abortion clinic. And, it's a very polarizing subject, very controversial, especially with the overturning of Roe. So I asked her about it. What are some of the misconceptions about clinic, about the health care that's getting received by women? She's very honest and straightforward. It's a very fascinating discussion. Wherever you stand on the topic, I think we can all agree violence doesn't solve anything. But it's very interesting discussion from her perspective on what it's like to care and how the laws differ from. She's in New Jersey, and what are the differences there? Some of the myths that are perpetrated, and she discusses them. But it's a great conversation with Elle. She's full of lots of energy. I really enjoyed the conversation. Thanks for listening. Hi, I'm Joey Pinz. People ask me, how did I lose 130 pounds? The quick answer is always discipline. I started my business, wasn't paying attention to my health, was eating too much, drinking too much sweets. My daughter was born. Next thing I know, I'm pre-diabetic, I have hypertension. I knew something had to change. Discipline. I, like many of you, have faced many challenges in your career, in your family, in your life, in your faith. How did you attack them? How did you approach them? How did you solve them, hopefully? It all had to have some degree of discipline. I'm also asked, how did you found and start a tech business that lasted over 25 years? Discipline. I was committed to it, enjoyed technology, didn't enjoy some aspects of it, but knew it was necessary. Discipline. Our podcast mission, how do we use discipline to better ourselves and society? Join me, please, as I talk to interesting people and discuss how they use discipline in their family, in their passion, in their careers, and how it helped them. Our podcast vision, growth through learning from others. Joey Pinz Disciple Conversations. It'll be light and serious. Join us, please. Thank you for consideration. To talk to Elle Kotopoulos. Thank you for your time. What should we know? What should the public just know about women's healthcare clinic, an abortion clinic?
It is a very crucial time. I mean, the changes that are happening right now are very evident in the work that we're doing. It is we are accepting so many more patients that are coming to us, a different type of patient, a more desperate patient. We are seeing things that we never saw before. So it is a definitely a pivotal time in women's healthcare and women's rights.
Yeah, as you're saying, Elle, I can't remember. I'm in my mid-50s. I can't remember a more kind of divisive time when it comes to women's rights and abortions, and you're kind of put right in the middle of it.
Yeah, I mean, it's definitely, we're feeling the changes for sure. I mean, everything that's kind of happening right now in women's rights and these changes are creating an atmosphere that we've also never seen before. The patients that are coming to us are coming from further away, they're coming from out of state, they are more desperate. Some of them, because of the lack of care that they have in their areas, are also taking a longer time to get to us because they're coming from so far. And what's happening is they are getting to us at a later stage in their pregnancy, which is also more dangerous for the actual surgery that they have to endure, because the further along you are in your pregnancy, the more difficult it is on your body. So you want to try to kind of get to it as early as possible. So, it's creating a whole bunch of new types of things that we're also seeing. But I will tell you that we are feeling it from many different aspects.
Now, you're in the Northeast of New Jersey. And as the time of this discussion, the federal government has says it's a state's right issue. So obviously, Jersey has said it's okay. What are some of the myths that people think that are about this, about your clinic, about these healthcare clinics that you can kind of dismiss and debunk?
Myths. Um, Things like abortions cause depression,
Mm.
abortions cause infertility, that we are inflicting violence on women. I mean, we are getting all kinds of, of nonsense and, so much misinformation that's out there now. Everybody has their opinion. People who shouldn't really have one because they're not qualified to have
Mm.
one
Mm.
are, spewing things and saying things that are scaring people. And, you're also at a time where anyone can hop on our Google reviews, right? And say in our Google's review, oh, don't go there. My sister died there. And you're like, what? And there it's just lies, and then you have patients that read these things and it scares them, and it's a constant fight to keep the patient educated and informed, and let them know that we are a safe place, and the type of services that we offer, and how these services are conducted, and why we do the things the way that we do, and how important it is to be affiliated with a hospital that's local and nearby. We are licensed by the state of New Jersey, and we are located in Montclair, and our Medicaid patients are the bread and butter of our business.
Hmm.
We service, a low income patient, which is also increasing. We're seeing many more of them as well. And, what we do here is a vital service. To the women, not only which used to be just the state of New Jersey, but now they're coming from other states as well.
Mm. And what is the law regarding that? If they come from a state where it's disallowed or unlawful, I should say, and they come to New Jersey, is that lawfully acceptable?
It is for us, and and for them, what we do here, we cannot. There's no legal ramifications for what we do here, because you are receiving your service in a state where you are entitled to do so.
Mm. Mm. Your father was an OB/GYN, and you can remember as a child him going and being in danger. And you didn't start here. You were in fashion, you were in finance, and you got kind of gravitated to this. You said blood kind of scared you a little bit, so you gravitated to this. What was it like being, in a household where your father's, life was a danger?
You didn't knowing what he was doing at a young age. It was a little confusing.
Yeah.
Was a little confusing at the time, but as I grew and I kind of noticed a little bit more, and my father used to take us to pro-choice marches in DC, and I was on his shoulders, and I was seeing the pictures, the pro-lifers, the yelling, the screaming, the all of it. And, I had questions. And,
Hmm.
as I started to learn more and more about what he did, and I got older, I started noticing things, and I started noticing that, he was going to work in bulletproof vests, and shades were drawn at
Wow.
nighttime. And it was
Wow.
during a time where OBGYNs were getting shot. And my father not only was an OBGYN, but my father also was one of the original doctors who helped pioneer the allowance to get the gestational limit of pregnancy raised for
Wow.
abortions. He
Wow.
and his partners played an integral role in consistently writing letters to the board of the medical examiners to let them know that we could go further from 14 weeks to 15 weeks to 16 to 17. And he was a key member in getting that accomplished, which is amazing. And now the state limit has been 24.6 weeks, and even further. And we do what we can for the women that need the services when they need them.
And it does that change your New Jersey's 24.6 you mentioned? Other states have different week limits?
They do. They do go state by state.
And what's the lowest that you've seen? I'm very new to this. I apologize.
That's
What's
okay.
the lowest you've seen?
Well,
Yeah,
the lowest I've seen, well, now you have 6-week bans, right?
6 weeks.
You have 6-week bans, which women don't even really know that they're pregnant by 6
Right,
weeks, right?
right.
I mean, there's no way to know. And here we unfortunately, you have women that come to us later term, and they're not coming because, all of a sudden they've decided, well, I'm so far along in my pregnancy, I've decided to, terminate. They're terminating because there's issues. We had a woman
Mm,
that came to us from the state of Georgia who, later on in her pregnancy, I believe she was about 20 weeks along, was told that her baby was growing without a skull. And in the state where she was, they would not terminate her pregnancy. And if she
mm,
had stayed where she was, she would have had to give birth. And it is so traumatizing to hear these stories. And these women want these children, they want these babies. I mean, she came to us and asked us for hand handprints and footprints, ink prints, if we could help her do that so that she could,
mm.
always have that, baby with her. They're terrifying cases, and they really, really pull at the heartstrings. You have women that are coming to us that are uh, have 3 children in their car driving under the age of 4, have $20 to their name, have a pregnancy that is later term, have nowhere to stay, and are asking our security guard, can he please just watch the car for a little bit while she has her termination? I
Wow.
mean, it's these, and then you think to yourself, and she's coming from a state where she would have to have that pregnancy, but how can you burden a woman like that? How can you expect that, that child who she would not give up? I mean, it's so difficult for a mother to do those things. How would she feed that child? How would she raise that child? These are things that all women and mothers, and we take into consideration. These are very difficult decisions that they're
Yeah.
making, and ones that they rightfully should be the only ones that are making.
Mm.
But you asked me about my upbringing, and here we are talking about the talking about the facility again. So as you can see, yes, my path has taken me to a very passionate part of my life.
Getting back to the condition of the women that come in, uh, is there a majority? You just described one heartbreaking, case where the woman has 3 kids under 4 in the car, and is there a more popular? Are they often that desperate?
No, 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 they're not often that desperate, but I am describing to you things that we see that we shouldn't have to see.
Good. Yeah.
But the good thing is that, with the changes that have been made, and since the overturning of Roe, and we have had
Mm,
so many others that have come up to help us and help these patients from a financial perspective. We have abortion rights supporters that, people like the New Jersey Abortion Access Fund, who have come to us and said, if you are taking patients that are having trouble financially and that need some assistance with their travel, with their hotel, with their termination, please let us know. We want to help. And that has been a key factor in the service that we have been providing. And we are so fortunate to have helped them. We also have aligned ourselves with organizations that help victims of domestic violence as well as human and sex trafficking. We have they also come in. They need services as well. It's their terrifying cases. They're young cases. We also work very closely with the special victims units and their detectives, where they need
mm,
our services to help get DNA for an evidence for their rape cases.
wow.
So, these types of things that we do, we're very proud of, and we're proud to be able to help in the way that we do. So it's not only about, women terminating a pregnancy, it's also a service that is used for so many more reasons. I mean, it really is life saving.
Mm. And to those who may say that the patient gets talked into it if they really don't want to do that, you say what?
I say that, when they come to our clinic, you are coming alone, and we have counselors here. We are having discussions with our patients. They're not just coming in and we're saying, all right, here you go, hop up on the bed. Here's your anesthesiologist. We are sitting with them. We're talking to them, getting to know them, asking them about their medical history, asking them about their family. We have to do these things. We have to get consent for what we do. If there is ever a time where we feel that there is any sort of doubt, we're not going anywhere. We tell our patient, we are here. You can come back. You do not. You can get on the table and say, you know what, doc, I'm not okay. We're going to help you. We can reschedule you. And I mean, it really is something that, we are very sensitive to. And it's happened.
To a pro-life advocate, what do you say to them, Elle?
You don't know enough, and you cannot judge. We have them outside of our doors every day.
Wow.
They are here. They are handing out flyers. They are opening crisis pregnancy centers where they are actually telling patients, scheduling appointments, saying that they are an abortion clinic. There's a crisis pregnancy center right down the street from us where you're entering, and they are attempting to change your mind. They're guilting you. They're showing you pictures. They're giving you false statistics and misinformation about how, if you don't have this baby, you might never have a baby again. Just all types of things that are incorrect. So to the pro-lifers, I say, stop it. Educate yourselves. Educate yourselves. It has nothing to do with, babies and saving lives. I mean, it's about the mother. It's about women, and it is their choice to figure out whether or not they are able to take care of another life. And it is strictly their choice. And, that's how we feel. So they're here every day. The majority of them are men. The majority of them are men that are here, which we find, very funny. And, the interesting thing is I do have one protester that's outside who is used to be a social services worker. And he would say to me, have you ever, worked with child services? I'm like, yes, we have worked with child services. How you are here is unbelievable to me. There are so many, you talk to me about, they can give it up for adoption. Okay, but there's other children that are ready to be adopted who are currently suffering in the system. Why would we continue to add more children into that? You should be helping those children. And if you decide that you want to protest the system for the adopting and the fostering system and raising money for, I'm like, just tell me where I need to be. I will be there with you. But you here? What are you doing here? And by the way, when our patients come, they do have the option of adoption. We have an adoption lawyer. We have someone that we can refer them to who helps place that child if that is a choice that they want to make. So that is an option that we have for them here as well.
Do you have picketers at the Crisis Pregnancy Center?
No. And interestingly enough, we have, there is a wonderful group called the Rainbow Escorts, who what they do is they put on these like very colorful vests. And when it's raining, they have, rainbow umbrellas, and, you can find them on social media. And what they come and do is they will stand outside the facility. And when they see, or they'll stand outside of the crisis pregnancy center, and they'll say, oh, are you here for a termination today? Yeah, you don't want to be here. You want to go down the street. You're going to go that way. Or, when the picketers are outside and, you have a woman who's coming in to have a termination, arguably the most difficult day of her life. And while she's walking into a facility, she also needs to hear from a guy with a bullhorn that she's a murderer in her ear. I mean, and what the difficult part about it is that then these women are coming in, they're bypassing these people, coming in a state of just, they're shaking.
Mm.
it's already been just a difficult decision. Now they're shaking, and it changes the type of patient that we have to care for now.
Hmm.
Because now we are dealing with an anxious patient who needs more anesthesia, who needs
Mm.
anti-anxiety meds. We're giving her more medications to calm her down. So it does affect the patient. So these rainbow escorts are wonderful. They will see a patient coming down the street and they will grab them by the arm and say, come on, I'll walk you to the front door. Oh, don't pay attention to this guy. You definitely don't want to listen to that guy. No, you don't want that flyer. You want nothing to do with that. And they will bring them right in. And the most wonderful part about it is they sit outside with their phones. And God forbid we have somebody with a voice amplification device. They will call the police. They will take a video because you are not allowed to have a voice amplifying device outside in the street. It is a public
Ah.
nuisance. There are noise ordinances, and you can get issued citations, violations, things like that. The type of picketers we have are, they're few. Once you usually get around Good Friday and Easter, the church congregations like to come, and it gets a little crazier. But the other facilities that, my father started a facility in Englewood called Metropolitan Medical Associates, who has a history of a much different protester. Many of them that would chain themselves together to the doors of the facility. They would hold hands and not let patients in. And these protesters have been a real issue. For historically, they've been an issue. But the real problem is, the police who would like to be able to get involved. You have to also kind of think about it. If they do too much, are they making a political statement? If they do too little,
Mm.
or that. So it's a very kind of slippery slope working with the police. We love what they do, and we're so thankful for them. But they also have to kind of be careful, and do what they can without really kind of taking any sort of stance that could be misconstrued.
Mm. You mentioned 24.6 weeks. Is there an age requirement?
For an abortion?
Yes.
No, there is not. And, a lot of people don't know that even when minors do come in here, when they are pregnant, they are actually emancipated, which means that they can also make their own decision to terminate, and they do not need the permission of a parent or anything like that.
Really? So a 13-year-old
Yes.
comes in. They
Yes.
don't need permission from their parents.
They do not need permission from their parents because they are emancipated, they are pregnant. But what we do then is we have to ask certain questions, because at that point, you also have to ask, okay, how did this happen? Is there a crime that we need to be aware
Oh.
of?
Oh, I see.
At that point, we have to is there, if it's how old is the person that you were involved with?
Hmm.
If it's another 13-year-old, there's really nothing you can do, right?
Right.
But at the same time, I do also need to call our special victims detectives, let them know
Hmm.
we have a minor
Hmm.
here. How would you like to handle it? What would you like to do? And we do have to ask some additional questions. We have to. It's,
My
we are
goodness.
mandated reporters. Sometimes
Hmm.
is it child negligence at that point? How did that 13-year-old, come to be in a situation where she could get pregnant? Is it
Mm.
child
Mm.
negligence?
Mm.
So when we say that we are mandated reporters, we also do need to let child services know when something like that happens.
Ella, it's so much work, and I mean, is it worth it?
It's so funny that you asked that. A lot of people ask that, and it is a tough job. And
Yeah.
my brother, who is an attorney and has been dealing and working, doing this for over a decade now. I've only been doing this since 2018. And the one thing, we always say is, you go home and, our husband, our wife, comes and says, "How was your day?" Just don't ask.
Mm.
Just don't ask. Every
Mm.
day is a tough one. Every day is a tough one. And, sometimes you get the little victories here and there, or you get to take care of a patient from Georgia with 3 children in her car who breaks
Mm.
down in your arms crying and says that she will remember you forever.
Mm.
And those are the days that you go home feeling good. But it is a tough job. And watching it come under attack and possibly be something that is taken away, a right that is taken away. It's infuriating. It's infuriating. But we will continue to fight. And I am very, very proud of the work that we do here at Pilgrim. And we have a fantastic staff, and they're very proud of what they do as well. So we're going to be here fighting till the end.
Good for you. And you mentioned there's no age limit. Do some states have an age limit?
um I don't know.
Hmm. So how do the laws differ from state to state other than the number of weeks? Is there anything else?
I wouldn't. I mean, that is a fantastic question for my brother who, follows this from the legal
Hmm.
perspective and the state regulations and limitations. I really don't know. I don't know how each state, now, because it's also so new, right? And
Hmm.
now the states are all kind of making their own decisions and their own rules and regs. Things are constantly changing. So I wouldn't know. I mean, I'm definitely not up to speed in being able to answer, how Minnesota is doing stuff.
Hmm. Are there improvements for the state of New Jersey that could help you?
Um, are there improvements for the state of New Jersey that could help me? Um, it would be wonderful to be able. It was just yesterday that we were talking to the township attorneys here in Montclair, because the protesters it's a real issue for us. And one of the things that we were talking about was, can we install some sort of ordinance for a buffer zone
Hmm.
outside of our front doors, 8 feet. You have to stay 8 feet away from the front door of our facility. It would be really nice to be able to do that. But, the tough thing about it is then you're kind of, infringing on, the constitutional right of people's free speech. You
Hmm.
can stand outside my facility, which is a public sidewalk, and
Hmm.
say anything you want. Hate speech, anything really, because it's your constitutional right to do so. So it's very difficult when you start talking about public sidewalks, which is where the facility is.
Hmm.
So what can we do? It would be nice if we could get some sort of buffer zone so that everybody's happy. You want to talk to our patients as they come in, okay, just do it down the street. But our escorts will be there. We are um, seeing, like I said, the financial situation of these patients that are coming to us is dire. Funding is very important to us.
Hmm.
The funding that we have is wonderful. Yeah, I would say, that's really where we are right now.
Elle, I asked you before if it's worth it. I mean, you're in finance, you went to fashion. Are there days that you wish you were there?
It's funny because I think about my transition, and I studied finance at Columbia University in New York. And when you get out of college, you kind of follow the herd. And I went into investment banking, and I did that whole thing. And
Hmm.
I was working, downtown, and I was there when 9/11 happened.
Hmm.
And I got to experience that whole thing firsthand. And after that, that was kind of my first experience, the first time that I said, you know what, like I'm good at numbers, but man, I can't, I'm not going to die for this.
Hmm.
And it was, I have to change. Something needs to change. And the only reason why I ended up going into fashion was because I had a friend of mine who was working for a brand, I'm sure called Mark Echo, and they were needed financial people in there, working with the CFOs and doing, some sort of financial planning for the company. So it was an easy transition for me. And then, I just I'm a very kind of go with the flow person. And, that all kind of led to learning about that industry and how it works, and margins and factories and how things are made and how the buyers work and how everybody makes money. And I decided to start my own brand. So I did that too.
Wow.
And I started my own brand, an accessories company, which was amazing. And then I ended up selling that company to an investor, which was fantastic. And, then I started a consulting company to actually help other designers who were looking to get their brands out there, get their brands manufactured, PR, everything, a brand assembly, if you would. Which was also very fulfilling. And, the one thing that has kind of followed me is my willingness to help people. I loved helping my designers. I loved starting a company and having employees, and I loved watching them grow and giving them the tools that they needed to, you know, better themselves. And it was funny because just at the end of my consulting company, which I was just about to sell, the owner of this specific facility was a very dear friend of my father's, and he passed away. He died unexpectedly. And I got a call from my brother, and my brother said to me, I need you to move out of Manhattan. I need you to move to New Jersey, and I need you to run an abortion clinic. And
Wow.
I was like, what? What do you mean? I was like, I make and sell t-shirts. And he was like, you can do this. If this place closes down, it would be a catastrophe for women. It
Hmm.
would be a catastrophe for women. I don't trust anybody else. You can do it. You have my full support. Just come. And just like that, I moved. Moved, left Manhattan. I came to New Jersey. I walked into this place in 2018, and it was insane. I mean, I sat down and there was not a single computer in the place.
Hmm.
Everything, I was opening up cabinets and policies and papers and medical journals were falling out. And, my brother handed me 6 binders that were about this big and was like, I need you to read this and familiarize yourselves with the policies. And it was insane. And I had this, baptism by fire, just learning how to run this clinic. And, again, I had to kind of step into the shoes of a man who ran the place, but he was a doctor. There
Hmm.
was no administrator per se. So I sat with the staff. I listened to them. Tell me, guys, like, how are things done? Tell me what was working. Tell me what wasn't working. And we kind of just went from there. And, I found my key people. I call them my lieutenants. I love to call them my lieutenants. And, I have empowered them to, make the decisions that they need to make. And they make mistakes. We learn. They do wonderfully. We grow.
Hmm.
But the one thing that changed and is I'd like to think is very evident now is that I believe that it's very obvious that this facility is run by a woman.
Oh.
And I love that. Before it was a doctor, and he was an excellent doctor, but it was very, come in, do your paperwork, get your surgery done, next, come in. And that's what it was. But now I feel like this place is, it's special. It really is. The doctors that we have here are wonderful. We have anesthesiologists that are here. A lot of people don't know that a lot of abortion clinics, when you go, you don't get anesthesia.
Hmm.
You might get a local sedative, but a lot of people don't know that. A lot of people also book appointments to go get a termination. There are facilities out there that advertise that they do have anesthesia, but what will happen is you'll get there and they'll be, oh, our anesthesiologist called out today. You know what? You'll be fine. Just pop up on the table. I'll be done in 5 minutes. And you're like, what? But we have board certified anesthesiologists here, and they're amazing. And we give such tremendous care and such tremendous follow up care. A lot of people have been asking about the abortion pill, and they've been asking about telemed, right? And now there's something happening where you'll be able to pick up a prescription, from CVS for an abortion pill, which yes is wonderful and definitely a nice option to have. But a lot of times people say, well, why don't you guys do that? How come you guys aren't doing telemed? And one of the things that we like that's important to us here is your continuity of care, right? You come into our facility, we give you an abortion pill, you have met your doctor, you have been assessed, we've taken a full medical history, we've done your ultrasound, we've done your sonogram. A lot of those pills sometimes don't work.
Hmm.
Some of them only partially empty the uterus. So now you go home, you take your pill, and what happens afterwards? You're continuing to bleed. Something happens overnight. Maybe you have an allergy you don't know about. Who are you calling? You're running to a hospital. Okay, you're going to a hospital. You're telling me you got an abortion pill. these are the crazy things that we think about. Is the doctor that you're going to see, is he pro-life? Is he going to do the rest of your termination? Is he going to, we just don't know. So we like to say that we want, as soon as you are our patient till you are done.
Hmm.
We want to make sure that you come back to us. You come back in 3 weeks. We're going to look at your uterus again. We're going to make sure that it is completely empty. If it is not, we're going to give you more pills to make sure that everything is going exactly as planned. We are going to hold your hand from the beginning to the end. And that is why we don't do the telemed. We think it's definitely an option for people that have a hard time getting it. I'm not knocking it, but I'm saying it's just not what we prefer to do.
Yeah, that was just released recently. The news
Yeah.
that pill will be available at drugstores. It's
Which is
you
a
may
good option.
yeah, it is it you do recommend it,
I do recommend it, but again, if you're in New Jersey and you are close to us, please just come.
right?
Please just come. If you are somewhere where, it's difficult for you to get, and, we absolutely understand that, you have to have access to these things. But if you are within, any of the range of any of the facilities, whether it's, here at Pilgrim or, MMA and Englewood, Metropolitan Medical Associates, or, Women's Choice and Hackensack. I mean, these are places that have fantastic doctors, great care. Planned Parenthood absolutely offers these things. But it's just something that we would prefer to do here.
And that pill, L, that's different than the day after pill, correct?
Correct. So what the now we're getting into a medical conversation, so I'm not really gonna, I don't know much about the terminology of it, but basically, what that abortion pill does is stops the growth of the pregnancy and triggers the uterus to shed itself.
I see. You mentioned before when you got there weren't any computers on the desk. How has technology influence helped your business, healthcare?
It how is it has helped is, I mean, being able to schedule an appointment, being able
Mm,
to look up if a patient, has been here before. All obviously the wonderful thing and conversations that you and I are having right now,
mm,
to help get the word out there about safe and accessible care. So many ways. And it's something that, again, we are very proud of. And, when I first started, it was a difficult thing to do. I started applying for grant money, and we ended up,
mm,
falling into the lap of a wonderful organization called the Research for Abortion Delivery. And they helped finance us and all of the changes that we made to this place, which were we made a lot of changes, lots and lots of changes. I mean, even it was, and it's amazing to see the changes that and what happens to even the patient when they see a peach color on the wall rather
mm,
than, a morgy blue color. You have a happier patient. You have a happier patient, a more patient.
mm.
Um, and, I think that, and even some of the patients that have been here, from back in the day that come now, they are like, wow, look at this place. So, again, we're very proud. We're very, very proud of it. And, the town of Montclair, where we are, is also a tremendous town and is very much supports what we do. And, we're very proud to be part of the town. And, the interesting thing is that where we actually are, our building, we are across from the Wellmont Plaza, which is, a very like historic district and very artsy. And the town of Montclair recently came to us and asked us if we would be willing to let an artist paint a mural on the exterior of our building, the entire exterior of our building, which is amazing because, it will bring attention to the facility.
Cool.
The town of Montclair is doing a national call to artists where they will be informed of, okay, there is an abortion clinic in Montclair and, this is what they do. And you'll be able to submit your art, and there will be a panel of jurors that will take all of these submissions, and it's going to be a pretty big deal. And we're very, very excited to participate in it.
I mentioned technology before. Has artificial intelligence been a part of your business at all? AI?
No, no, no. No, not at all. I haven't seen anything yet to be able to say that I've seen anything concerning or beneficial or non-beneficial.
As a business, as your women's healthcare business, is it much more difficult? Is it very different from other healthcare small to medium sized businesses? Is there certain things that you have to? I know you've kind of put your own touch to the aesthetics and to the welcoming, but I just wonder, just as a small business, is it more difficult to run than other healthcare small businesses?
Um, I don't think so. I mean, I think that, making the fact that we are a state licensed facility and we have to
Mm,
adhere to the rules and regulations of the state of New Jersey, that in itself is very it's difficult. It's difficult. It's a lot of work.
mm,
And again, these rules and regs are changing all the time. So when you compare a facility like ours who has to maintain those rules and regs for our license, and that the state can come in at any moment and survey us and make sure that we're doing things the way that we're supposed to be doing. We need that license to be able to service those Medicaid patients. Other surgery centers may not. They might just uh, they might operate just taking private insurance, and again, that makes it a little bit easier for them to kind of do things the way that they want to do things. So we are held up to a higher level of standard because of
mm,
that license. We are constantly under scrutiny. We constantly have to have infection control consultants that come in, every 6 months to make sure that we're doing things correctly. We need to
mm.
have pharmacy consultants come in here to make sure that, we're not making medication errors, or, making sure that controlled substances are being dealt with correctly. We have fire and life and fire. We're supposed to be doing disaster drills and fire drills, so we have guys that had to come in here 4 times a year, and they blow smoke under a door, and got to watch how we handle it. The one thing that we have now started doing is active shooter drills, which is new for
Jeez.
us, because you just never know. After COVID happened, a lot of people didn't know or realize that we were deemed essential. We were deemed essential. And the reason why we were deemed essential was because you cannot close down or tell a pregnant woman to come back in 4 weeks. So when a pregnant woman comes into your facility, we need to get that case done. So we were deemed essential. We never closed down. The only thing we could do was say, you know what, we can only allow patients into the building. No more rides in the building. You cannot come, please, tell your loved one to meet you at the door. And
Ah.
so we only have patients in here because we were trying to do social distancing, because, and then after all those regulations kind of dropped off, we all kind of looked at each other and we're like, it's probably safer for us to continue working this way as well.
Hmm.
We had pro-lifers come in here and check into security as a couple that was here to receive services, and before you knew it, they whipped out holy water and started throwing it at all the patients, screaming mommy mommy mommy.
Wow.
I mean, and then you go to security and you look at the check-in log and they checked in as Mary and Joseph, and you're like, wow.
Hmm.
I should have been a sign, but okay. So even things like that, we're like, you know what, let's keep everybody outside except for the patients. It's safer. So now we're doing, active shooter drills. You never know. You might have an angry husband. My wife didn't tell me she was going to be here today. You killed my baby.
Mm.
Who knows? You guys are a bunch of murderers. Let's have somebody, run. And could it be a woman? Could it be a man? I mean, so now we're running all of these drills, and it's scary. It's scary. I don't like them, but we got to do them.
Mm.
It's scary. And then, you think about getting out there and talking about the facility, and, putting me in front of people and talking about, what we do. And, my father was always a very private man. We don't talk about what we do. We don't talk about what we do, was always his thing, protect your family. But I can't. I can't. It's
Hmm.
too important. It's too important. So I will tell you that, our family has never been out there talking about it like I am, but I feel like my work is important and I'm proud of it. And it's what I want to do.
Oh, how has the overturning of Roe affected you and your business? Elle, how has the overturning of Roe affected you and your business?
Well, there's a couple of things that has happened. I would say the first and foremost is, again, we've talked about this desperate patient that we're seeing. Okay, so
Mm.
we're getting these desperate patients that are coming to us in needs in the beginning, with needs that we couldn't really fulfill because of finances and and means of such that we have now been able to fix. We have like I said, stronger support, which we never had before, which is nice to see as well. And to tell you the truth, I think that the third thing I'm about to say is probably the biggest, is we have a more emboldened protester. I
Uh,
feel like they really think like, oh, we did it. Let's just keep
mhm.
doing what we're doing, louder, stronger. We need more presence. And that's kind of been something that we're seeing. And it's frightening, to be honest, because now what we talk about a lot is, all right, so they were protesting where in Georgia, they were protesting in Texas. So they all look at each other, right? Job's done. What state are we going to next?
Hmm.
Our work here is done. So we think about it as from those perspectives, like, oh, they're coming. And when we sit with their town, and when we sit with the townships and we tell them like what we think is going to happen, we do think that we're going to be seeing increased protester presence for sure. That's something that we definitely have seen, and we are definitely seeing more of an emboldened protester.
Hmm. Violence, but it seldom escalates to violence, though. Correct? Which is
Not
protest.
by us.
Good.
I've seen it happen. I've seen it happen where
Mm.
husband and wife are dealing with a very traumatic loss of a pregnancy. Protester decided to say something. Husband punched him in the face.
Uh,
And the
mm,
protester looks at me and he says, "Call the police." I will do no such thing. I will do
mm,
no such thing. So from time to time, yes, you will see that. But no, I have not seen anything, no grabbing of anything, no grabbing of patients. What they do, like I said, is they will stand in front of the doors. They will say despicable things, say untrue things. They will attack us on our Google reviews, try to scare people. And, the other thing is, very interestingly enough, something new that we saw was, lots of times we have, from time to time, we have patients that need to be transferred to hospitals. They are allergic to a medication they had no idea they were allergic to. They have a seizure disorder that they decided not to tell us about because women are scared. They don't want not to get their
mm,
abortion. So they won't
mm,
disclose certain things. I don't want to tell
mm,
you that I suffer from seizures. What if I don't get my abortion? So they
mm,
will run the risk of, of something like that. And what'll happen is then, they'll have a seizure. Well, oh, great. And, we'll have to call our ambulance and transfer the patient to one of the hospitals that we have transfer agreements with. And the wonderful thing is about those hospitals is the doctors that work at those hospitals that are receiving those patients are actually doctors that have worked here before. They've done these terminations before. They know how we work. They know the type of patient. So they know exactly what type of patient they are receiving from us. And we recently had a transfer, and there was a pro-lifer who was out there and decided to take her phone, video the whole thing, throw it up on Twitter, and start talking about how we're hurting people. Abortions are no good. Look at this. They're killing people. No, lady, that's not what we're doing at all. And actually, what we are doing is providing excellent care. And let me just use this platform, since we're here, pro-lifer, to remind all patients, please make sure that you're giving us your full medical history. Please make sure you're telling us that everything that you're allergic to, because what people don't realize is we are just a clinic. We are just a clinic. We are not a hospital. If something happens to you, we don't have everything that we need here. We need to have these relationships with these hospitals for that reason. So as long as you tell us everything that's going on with you, we will help. So let's just get that out there. What you saw, lady, was us providing excellent care, actually.
Very good, Elle. I love your passion and your enthusiasm. So I started my business back in the 90s. I'm in the tech field. I was working way too hard. You're very familiar with this. I wasn't paying attention to myself, Elle, and I got myself up to 340 pounds. Poor diet, wasn't exercising anymore. The doctor said to me, if I don't lose the weight, I'm not going to see my daughter graduate. My daughter was just born. I spent the next 6, 7 months, lost about 130 pounds. People always ask me how, like there's some trick or some secret. I always say discipline. That's how I lost it. I wonder how discipline plays a role in your life, Elle.
Joe, I got to tell you, I am not too many years younger than you. And I also have two children that I had later on in life who are 7 and 9.
Mm,
I am a working mom. I have a household to run.
mm,
And above and beyond, I am a very firm believer in you got to take care of yourself first.
mm.
I would say that my husband would probably be laughing. I'm up at 5 a.m. I am, exercising by 6. I am, following a regimented diet. I am on the phone with my brother while I'm driving to the facility, talking about what do we got, what's going on, what are we doing, how are we going to make things better. As soon as I get to the facility, I have a slew of people that are waiting outside my door to tell me about all the problems that we had with, patients and all that stuff. But I am out the door by 5 o'clock. I am home with my kids to take them to their sports, make them some dinner, and then finally, put them down and collapse.
Wow.
Discipline for me is something that I inherited from my father. It is really important. And it is funny because as you get older, it gets harder. It definitely gets harder. And I always laugh and say, in our age, I don't know if you're experiencing the same thing. Every morning feels like you wake up and you're like suffering from rigor mortis. You're like, oh my God, why does it hurt to sleep? But you take care of yourself, you exercise, you do the things you got to do, because I am very busy, but I also feel like at any moment I could be needed for an emergency, a patient, the Department of Health, my child. At the time I lost my mother about a year ago, and I had an ill mother. It's so many things, right? So it's like you always feel like you just need to just be ready. And that in itself is so difficult and so tiring. And in that, I also need to provide an atmosphere for my staff where they are happy and feel supported. And, they always come to me and they're like, boss, do this, boss, I need this. And I'm like, guys, you guys stop. Like, I am not the boss. Like, you guys are. Tell me what you need. Tell me how we're doing things, and I will find a way to support you. It is not an easy job to fill when it comes time to needing a nurse, needing a medical assistant, getting somebody in here to come work at an abortion clinic. And, the way that I kind of like to keep, my soldiers here is by, giving them these amazing benefits that we have. I have young moms here. I got young staff. The women that have been with me for 5 years or over, their kids are getting free daycare. There's a daycare center right here in Montclair where we are also, so proud of supporting the town of Montclair, and their kids are here. And before they were home with grandma on, tablets. And, I was just like, guys, get the kids. You guys have been with me for so long. I don't know what else I could do. Just get the kids. Let's get them some daycare. And now they're so happy. And, the kids are happy. So, in all of the exhaustion, and all of the care, it's really about the staff, right? If the staff isn't happy, how are they supposed to deal with the patients? How are they supposed to give that care that patient needs, who's here, like we said, on a very, very difficult day? For me, my job is my staff, and their job is the patient.
Mm.
And it is something that I take to heart and I take very, very seriously, because I feel like that is the only way to lead, man. The only way to lead is from the bottom.
I have this ongoing, thesis, L, that discipline is a spectrum, and some of the things you mentioned: focus, restraint, mastery, control, routine, order, willpower, direction, strictness. You exemplify all those quite well.
I'm very tired, Joe.
Ha! That's okay too. That's okay too. Elle Kotopoulos, what motivates you?
Am I allowed to say my kids, man?
You're allowed to say whatever you like.
Am I allowed to say my kids? I got a daughter, she's 9, and I look at her and and she used to come to work with me, and I'm a numbers girl, and she used to say, Mommy, what do you do? And I'm an accountant by trade.
Hmm.
Those numbers thing. I used to sit here to teach her how to use a calculator. She's 9. She's got questions.
Hmm.
She's starting to see things, and um, man, she's proud of me.
It's
My
nice.
girl. She's proud of me. We have a bunch of women's societies around here that are local, and what they like to do is get together at church. You ready for this one? They like to get together at church, and they put together care packages for our patients. They put together little bags, little shopping bags, of these very happy colors, and they will put in a granola bar. They'll put in a note, "You are loved." They'll put in a maxi pad. They'll put in, what else have we? Oh, a pair of socks, a scrunchie, eye patches, and they get together and they have these packing parties, and they invite me to speak.
Hmm.
So I can tell them about how the patients are loving, getting these things, from us, and I've invited my daughter to come, and she's going to hear me speak for the first time. Which she said to me, she goes, "You're not going to make me stand up there, are you?" I'm like, "No,
Ha.
just come and hang with me, and let's talk." She's watching, right? She's watching, and my
Mm.
little guy is still little, and all he cares about is Minecraft, but you know what? Like, he knows that, mom works. And at nighttime, he'll say to me, "Mommy, are you comfortable?" I'm like, "Yeah, I'm
Aw.
comfortable." Like, "I just want to make sure that you get good sleep so that, you're not tired at your job tomorrow." My kids, man, my kids, I want to create a life for them that they will remember. I want to create, a mommy for them that they will be proud of. They are, they're exceptional, and I'm proud of them too.
So, given that, how do you measure success?
Um, you know, how do I measure success? My ability to truly disconnect.
Hmm.
Um, I feel like when I finally disconnect and I look at my husband and I'm like, "Pack it up. No, the kids are not coming. It's just me and you."
Hmm.
And we leave and we head to a beach. If I have the ability to take the phone and turn it off and put it down for 2 days, 3 days, and truly disconnect, that means I've done something right.
Wow.
I have left something behind that I know is just the wheels are turning. Excuse me. And that means that I've done it right. So the ability to truly disconnect is how I measure success.
Getting off the grid.
Off the grid. Excuse me, Joe.
Elle, thanks so much for this. I was very excited when we set this up, and you're an inspiration, and we need to hear more voices like yours. And no matter where you stand on the particular abortion issue is irrelevant. We're all humans at the end of the day, and when nobody, violence doesn't solve anything. And we're all humans, and we want the best for us and our family. Anybody who's listening, how can we get in touch with you?
You can call us directly at the facility in Montclair, 973-746-1500. You can find us on Instagram as well as TikTok, at We Are Pilgrim. Please get on our social media, share our social media, ask us questions, interact with us. Ask us difficult questions. We are here to not only service people, but we are here to spread the information that needs to be out there, the safe information that women need to know so that decisions can be made from an informed perspective.
Very well said. Elle, thanks so much. If I get in the neighborhood, perhaps your husband, you and I can get a cup
I
of
would love it.
tea
I would
or
love it. And we're going to turn our phones off, right?
turn our phones off and, maybe have some ouzo.
I love it.
Uh, thank you so much. You be well.
You too.
Thank you for listening and or viewing Joey Pinz Disciple Conversations. Please share this episode with one or two of your friends who you think may benefit from the episode. Our website, www.joeypins.com. There you'll find lots of resources and you could join our mailing list. Please follow us on all our social media, Instagram, Twitter, and Facebook. Podcast information, the video version of our podcast is on YouTube. Please subscribe. Audio is on all major podcasting platforms. Please follow them. And if you like it, please consider giving 5-star rating. Would really appreciate that. Would you like to financially support the podcast? You can go to our Patreon site. Consider $5, $10, or $20 a month. There's all kind of plans that we have there. There's like a one-time payment. What is this podcast episode worth to you? $25, $50, $100, $500, $1,000, $5,000. You be the judge. You can go to our PayPal account to do that as well. Thank you again for listening or watching Joey Pinz Disciple Conversations.